So today we'll be talking about what it's like to actually live with visual impairment and various aspects of that, including the definitions. What is visual impairment? What is blindness, legal blindness? What are the causes in Australia and elsewhere? What are the visual requirements for a driver's license? Importantly, if you do general practice, you're guaranteed to come across this. And then what's the lived experience of vision loss and blindness, and what are the services available to people with, severe vision loss or legal blindness? Learning objectives are definitions and causes of visual impairment, driver's licenses, as I've mentioned, and then lived experiences and available services. You just need to have some awareness of these things. As far as definitions, look, visual impairment is also known as vision loss or low vision. There's differing definitions, such as best corrected visual acuity. So that's with glasses on, being less than 6/12. Some definitions will say less than 6/12. Some definitions will say less than 6/18, right? And then they generally have a lower limit, let's say, better than 6/60 or better than 3/60. And all of this is generally in the better eye. So we're interested in what's a vision in the better eye. Blindness, there's a more uniform definition for. So Australia uses the WHO definition. Again, it's the better eye and best corrected visual acuity, less than 360, meaning at 3 meters, I can't see what a normal person would see at 60 meters, right? So that's profound vision loss. Or your visual field is constricted to within 10 degrees, right? So if this is, say, 200 degrees of visual field, which we normally have, right, we can see beyond the midline here and here on our right and left. 10 degrees is very, very narrow indeed. So irrespective of what your visual acuity is, what you can see within that tiny 10 degrees, if it's constricted that much, that's blindness. Then there's legal blindness, which entitles you to things like disability pensions. Here, the best corrected vision has to be less than 660 in both eyes, right? Or field constriction to within 20 degrees. So this is relevant to line pension when patients start applying for that. And they'll need to see an eye specialist along the way as they make that application. It won't just be you. So aside from those sort of clinical and legal definitions, then there's functional vision, which is also really important. So this is what can the person, how well can they see to perform their activities of daily living? And so this includes personal, environmental, occupational considerations. So the take-home messages include both objective and subjective measures of vision loss. So I might say, this lady can only see 6/36, let's say, but she can meet most of her visual requirements with no problems at all. And then the converse might be true. Here's someone with 6/36, but they're really struggling. So you've got to include both. And blind pension applications have to include input from an ophthalmologist or an optometrist, and sometimes both. Okay, so that's definitions so far. If we're happy with that, let's move on to the causes of visual impairment. So in Australia, about half the population have a self-reported visual problem. And that might be as simple as, I need a pair of glasses, right? But as far as who's blind or vision impaired, it's just over 500,000 people. So think of the population of, let's say, the ACT or the city of Newcastle. It's a substantial number. And the majority of those are older, so 70 years or older. Sorry, 65 or older. So it's a disease of the elderly. A lot of it is degenerative due to degenerative conditions, and it's common. So you'll be seeing it. What about the actual causes now? So that's more about prevalence. This is the most recent National Eye Health Survey, which was done in 2016. And they surveyed adults in Australia, Indigenous and non-Indigenous. Among Indigenous people, the leading cause was refractive error, meaning need for glasses, followed by cataract and diabetic retinopathy. DR is diabetic retinopathy. All of those are treatable, right? So a pair of glasses for refractive error, cataract surgery if you have a cataract, diabetic retinopathy can be prevented or treated. What about for non-Indigenous? Similar with one main difference, which is AMD, age-related macular degeneration. This is lesser disease among Indigenous people, more among Caucasian people and non-Indigenous people. And diabetic retinopathy was much less prevalent. So about a quarter times as prevalent among non-Indigenous as among Indigenous people. But you can see glasses and cataract are the leading cause in both groups. This is in over 40-year-olds. So if you have a question which says, what are the leading causes of vision loss in Australia? And it gives you options, you're looking for refractive error and cataract right at the top, because Indigenous or non-Indigenous, that's common. And this is just to emphasize that the prevalence of blindness and vision impairment is 3 times as common among Indigenous people, and this is, we call this the gap for vision in Australia, due to many of the same reasons, unfortunately, as healthcare in general or health outcomes in general are poorer for Indigenous people. And there's a lot of work that is going into closing this gap. What about worldwide? Well, 2.2 billion people, that's about a quarter of the population on the planet have visual impairment. Again, leading cause is refractive error and cataract, both of which are treatable with pretty cost-effective treatments. So in at least 1 billion people, that vision loss is avoidable. And again, it's mainly middle-aged and older with a massive productivity cost. So about the GDP of Vietnam. You know, imagine a middle-aged person that can't work. Not only can they not work, they might need, very often in poorer countries, a grandchild to stay home with them and look after them, which means grandchild doesn't go to school or doesn't work. So it's a big global problem. And again, lots of work going into addressing this. So that's, I guess, the size of the problem and the causes of the problem. The take-home messages are, it's common, you will see it in your practice, regardless of what you do, and the leading causes are avoidable. Let's move on to driving standards now, which again, you'll come across definitely as a GP. This is the most recent fitness to drive standards in Australia, 2022. It's actually worth looking this up. It's a free PDF online if you Google it, because it's relevant to all fields of medicine: cardiovascular, neurology, hearing, ophthalmology. So this, you know, on first impressions, this probably looks quite complicated, this little flow chart, but it's really not. Let's go through it. So you start off at the top. What's the person's uncorrected visual acuity? That means without glasses. And most people will be interested in a private driver's license, right? Meaning your normal car or motorbike. Commercial means bus, truck, heavy equipment, lorry, that sort of thing. So this is more relevant to truck drivers and to FIFO workers who'll often be operating heavy equipment, right? But let's start with private. Is the vision at least 6/12 in one or both eyes without glasses? If yes, they get an unconditional private driver's license. If it's not, right, then, because mine isn't, if I take my glasses off, I'm not 6/12 in one or both eyes. So then you have to ask, with glasses on, do they achieve that number, 6/12? If yes, you have a conditional license, which is what I've got. I've got to be wearing optical aids to drive, glasses or contact lenses, as many of you probably do as well. If no, for a private driver's license, then you've got to refer them back to an ophthalmologist or an optometrist for clinical assessment of driving. So if they're close to 6/12, let's say, some will potentially get across the line for a conditional driver's license. But usually if they're nowhere near 6/12, it's game over, right? So not fit to hold an unconditional or conditional driver's license. That's for private driver's licenses. What about commercial? Similar, except the numbers are different. Here, the better eye has to be better than it has to be for a private driver's license. It's 6/9, not 6/12. The better eye has to be at least 6'9". There's also a lower limit for the other eye, which there isn't with private driver's licenses. Meaning, for a private driver's license, I can be 6'12" in one eye and be blind in the other eye. It's just one eye has to achieve at least 6'12". Commercial driver's license is different. Both eyes have to be decent. So better eye has to be at least 6'9". Worse eye can only be as bad as 6'18". If it's worse than 6'18", then it's got to be assessed by one of us. And then the process is similar. You get seen by one of us. If it's close, they might be eligible for conditional. If it's not close, then they're not eligible, right? So the numbers to remember there: private driver's license, one eye at least 6'12". If that's without glasses, that's unconditional. If it's with glasses, it's conditional. Commercial, one eye at least 6'9", the other eye at least 6'18". So you need to know those numbers. This is a great MCQ question, right? So that's the basic approach to driver's licenses. But it doesn't stop there, because that's only assessing one aspect of vision, which is visual acuity. What about visual fields? Well, I talked about your visual field extends beyond the midline to your right and your left. So you've got to have, let's say that's 200 degrees or even a bit more. You've got to have 110 degrees in the middle horizontally intact to qualify for a private driver's license. So at least about half of that visual field has to be intact so you're safe on the road, right? You can see where you're going. So 110 horizontally and then 10 degrees above and below that horizontal midline. So 10 degrees up, 10 degrees down, and 110 across. That's for private driver's licenses. For commercial driver's licenses, you can't have a visual field defect. That's what VFD is. So no visual field defect for a bus driver, right? You don't want someone driving 50 people around and they've got a visual field defect. So that's for binocular vision. What about, and we do visual field tests. That's what this image is here on the bottom. This is showing this person's visual field where the black dots represent areas where they're missing visual field. So if it's 110 horizontally, right? Look, there's a bit of missing visual field there. And 110 means 55 this way, 55 this way. Each one of these hashes is 10 degrees. So that's 10, 20, 30, 40. It's within the 55 degrees they've lost some visual field. And also within the inferior 10 degrees, there's a 10 degree hash inferiorly, they've lost some visual field. So this person's not fit for private and definitely not fit for commercial, right? We could show you that sort of image. And as long as you know those numbers, 110 horizontally, 10 above, 10 below for private, then you could interpret a visual field test like that, right? That would be a tough question though, because visual field testing is that's something that eye specialists generally do. But they're the sort of questions that can distinguish, let's say, gold star from, gold star student from a pass. Now, what about monocular vision? This is a person who only has one eye, right, or good vision in one eye. They are eligible for conditional driver's licenses. They just need to have a 2-yearly review to ensure that the good eye remains good enough. And the standards are the same as what we talked about on the previous slide. So at least 6'12" for private and at least 6'9" for commercial with good visual fields, normal visual fields. If you have sudden loss of vision in one eye, then no driving for 3 months, irrespective of how good the remaining eye is, because you lose depth perception. You immediately lose depth perception when you lose vision in one eye. And you actually regain depth perception, monocular depth perception, but that takes time to develop. So usually you need binocularity, you need 2 eyes to have depth perception. Yep, got a question? Mm-hmm. aren't they disqualified from being able to, depends on the task, and it depends on the vehicle. Chances are they will be if it's a truck, if it's heavy machinery, but let's say they've got a large van and they only drive it around their farm. This is not an uncommon scenario, let's say in the regional areas in WA, and there's no other transport in the local area, then that person's potentially eligible for a conditional license. Yep. So sudden unilateral visual loss, no driving for 3 months. What about diplopia, double vision, right? If someone's got a cranial nerve palsy, they get double vision. Well, there's no driving if the diplopia occurs within 20 degrees of their central vision. For example, you might have double vision that only occurs at the extremes of gaze. So when I look to my far right out here, then let's say I get horizontal diplopia. That's okay, because I don't have to do that when I'm driving. I can just turn my head. I can turn my head to the right and avoid getting diplopia. But if it's within 20 degrees of the middle, it's hard to avoid that. It's virtually impossible. And what you can do for acute diplopia, let's say someone's got diplopia, which is likely to resolve over time, you just patch one eye, right? That's a short-term treatment for diplopia. And then they've only got one image. They don't have two images, but you've effectively made them monocular. So again, that person can't drive for 3 months. But beyond 3 months, they potentially can. So there are some of the other considerations in addition to visual acuity, right, for driver's license. What about people with conditions like glaucoma, diabetic retinopathy, macular degeneration, cataract? They need to be monitored regularly because these are progressive conditions. They're also common. So they need to be seen at least once every 2 years by an eye specialist, if not more often. And conditional licenses in general are considered by the Department of Transport with input from eye specialists. So in those grey areas, like the person on the farm who's monocular, then that's something that the department will consider with information and potential support by an eye specialist. Okay. So it's not always black and white. Here's a notification of driving impairment where we've provided information to the Department of Transport saying this person should not be driving, let's say. Now, there's no mandatory reporting requirements for vision in the same way that there is for sexual abuse, let's say, or child abuse. There's no legal requirement. Your requirement is to advise people of their visual status with help from us and their obligations. It's actually on them to then approach the Department of Transport. Once people get to 80, then they're 80 years old, then they're getting annual eye checks. Right? Prior to that, it's 5 yearly, like our licenses will be. But if we think that someone's unsafe on the road, presents a risk to themselves or others, I've never had to do this. Most people are pretty sensible. But you can then contact the Department of Transport and advise them. In reality, if you're not an ophthalmologist, you'll be contacting one of us and saying, hey, I think this person needs evaluation. They're potentially at risk. Can you provide more information? So your job in a way is to pick that person who's lost vision in one or both eyes and is potentially at risk and still wants to drive. Some people will willingly give up their driver's licenses, but that's uncommon. Most people want to hang on to their independence. Okay, so that's driving. Any other questions about that before we move on? No. Okay. So then let's talk about visual impairment. What are the consequences for the person that's affected? They're not great, at least in the short term. So 3 times more likely to be unemployed, be involved in a car accident, suffer from depression and anxiety. It's a form of loss, right? So it's a sort of grief response. And then at risk of falling while they're walking. So here's a study that looked at people with inherited optic neuropathy where they get bilateral vision loss. Happens quite rapidly and it happens at quite a young age. So they can really describe the experience of going from having vision to not having vision. So it's As I said, it's a psychosocial sort of loss experience. But over time, these people develop coping mechanisms, practical things and emotional things that permit them to adjust to sight loss and have as normal a life as possible. But that difficulty can recur, and it's chronic and it's lifelong. So it's a bit like a chronic, it's a chronic illness. And so it's lifelong care is what people need. And it's I mean, it affects everything. It affects relationships, it affects occupation, a sense of identity. So you really need a sort of holistic approach to this. So you might need to involve us. You might need to involve psychology, psychiatry, occupational therapy plays a big role. So it's really, multidisciplinary. These are the services that are available in WA and nationally for people with severe vision loss or blindness. They're all in the city, and some of them do regional visits as well. So what do they provide? Occupational therapy, social work, as I mentioned, but also different types of optical aids. So they might be high-powered spectacles that aren't commercially available, or magnifiers, let's say big magnifiers that you can use to read a newspaper, read small print, loops, telescopes, so specialized optical aids. There's also assistive technologies, which, for example, can read your emails out loud for you, or read text on a page out loud for you. There's an app that you can get on your phone which will describe out loud whatever you're pointing your phone at. I forget what it's called, but it should be fairly easy to find. So if you point it at me, it'll say, middle-aged man wearing glasses, something like that. Okay. And sometimes it'll put a number to the age. And so that can be good or bad, depending on how old it thinks you are. These organisations also offer leisure, sport, recreation activities for people with vision loss, as well as employment assistance. So there's a lot of services out there. Vision loss is not the end of the road. There's a lot of successful people with vision loss, but certainly need support, and guide dogs as well. So many years ago, I thought I'd see what it was like to briefly experience blindness. So me and a friend got trained. He was trained as my sighted aide. I was trained to use various assistive devices, and I spent a day as a student blindfolded. I couldn't see anything. And then, we wrote a little article about what that was like. And obviously it's an artificial experience. I don't recommend you do it at home because it is risky. You need support in order to do it. You do need some training. But I guess my tips or my experiences were that people trying to help you can also hinder you. So if you're trying to help a person with low vision or blindness, ask before offering help. Don't just grab them. And if you are going to assist them to walk somewhere, walk alongside them. Don't yank or pull them, which some well-meaning people did to me just because they don't know. They haven't had the experience. Another funny thing is that people would sometimes speak to my guide rather than speaking to me. So make sure you speak directly to to the patient themselves, and you can use normal language. It doesn't have to be, you don't have to slow it down or make it louder unless they tell you that they have a hearing impairment, right? And a couple of times people just left without announcing it, which was a bit embarrassing because I thought we were in the middle of a conversation and then there was silence. So, if you're going to leave, announce your departure. Okay, so I think that's our time. What are we going to say in summary? This is vision loss and blindness are generally occur in middle age and elderly patients who often have other comorbidities. So multidisciplinary care is important. The common causes are chronic progressive diseases, cataract, refractive error, macular degeneration, glaucoma we haven't talked about, but that's common as well. They're often treatable or preventable. Keep driving in mind and remember what the standards are, and probably more importantly, be able to look up those driving standards quickly and work your way through the PDF. And what's the goal here? The goal is to preserve function, safety, and also dignity, person's dignity. Keep those things at the forefront of your mind. Very prominent Australians. This man has passed away, unfortunately, but Gurumul was an Australian singer-songwriter, multiple award winner who was blind in both eyes. Professor Ron McCallan's a law professor in Australia, Order of Australia. He's blind in both eyes. Nikki Hind is Australia's first blind fashion designer. She used to have vision, now she doesn't, after suffering strokes. So, yeah, there's no reason you can't be employed and thriving, really, with the right supports in place. Guys, hopefully we've covered those things. And thanks for listening.